So we deal with temporomandibular joint disorder conditions a lot. There is a lot of tension nowadays, probably for everyone, but in the Bay Area for sure. People put a lot of strain on their jaw and their teeth and are often surprised to find the connection between the teeth and the jaw, or their teeth and their migraines. So oftentimes we hold a lot of tension in the jaw, clench down on the teeth, and all of the muscles and the nerves that innervate all along there, connected to the neck and the spine, the head, can create a lot of pain and further issues reciprocating back on the teeth. So oftentimes, if there's a lot of strain now in the muscles, people will clench more, and that can cause a lot of breakdown with both the teeth and the gum and the bones. So temporomandibular joint disorder is TMD, and it's a little confusing because I'd say in popular culture, it's often referred to as TMJ, which is just referring to the actual joint, the temporomandibular joint, which we all have. And even if it's perfectly healthy, we all have a TMJ. So the way that the teeth come together dictates the stability of the joint. And in a reciprocal fashion, the stability of the jaw joint can sometimes dictate the way the teeth are coming together. So for a lot of us, if there's a tooth that is out of alignment or is too big or too small and it hits first, it's the first point of contact when you bite down, that can actually destabilize the jaw. It's kind of like if, in your car, you have one tire that's kind of flat or a little less pumped up than the rest of them, the entire alignment of the car is going to get out of whack, so it's very, very similar. So you have one point of contact that's uneven, it can throw off the entire stability of the jaw joint. The muscles around the joint get strained, and the innervation of the nerves around there spreads everywhere. So oftentimes, one little thing that's seemingly off kilter in the mouth can throw off pain all over the head, neck, even the upper back. One of the most common and I would say underdiagnosed indications of temporomandibular joint disorder are worn front teeth. So oftentimes patients will brace by pushing their lower jaw out and just resting on the edges of their front teeth and start to wear those teeth down even more than the back teeth. And that can often be an indication that the teeth are not supporting the front very well. And that's often, but not always related to jaw clicking, jaw stress. Even people push their lower jaw out like that, rest, and it just causes a lot of strain and tension on the joints and the muscles. Because again, you're still, even though it might feel relaxing to kind of settle out there, the whole system is connected and it's under strain. TMJ pain can be dealt with on a very, very almost holistic level by first treating the muscles. So there are, hot compresses, masseuses, and chiropractors and physical therapists that can relieve the actual symptoms from the muscles. But that really is kind of a band-aid, right? So it's kind of like when you go and get a massage, but you're not actually treating the fact that you have scoliosis or something. It's the same thing with jaw pain, where if you're not treating the actual cause that's making the muscles really tense or really strained, then it's going to become this constant thing. So one of the ways you can treat it is by creating what we call like an occlusal guard, or an appliance that you wear while you're sleeping. And that actually helps put the jaw into a healthier position, a more even position, without actually touching the teeth. So it's just a removable appliance you can take on and off. And at least then for portion of the day at night, the jaw is being helped into a more stable position where it's hitting more evenly. The problem with that is it's not actually correcting the way the teeth are touching for the rest of the day and how they function together. So when we're really looking at trying to stabilize a jaw that is unhappy, we're really looking at trying to look at the bite. So moving the teeth or rebuilding the teeth into a position that is more stable and even, that can help the whole system relax. Jaw pain absolutely can. So if the joint is overactive or strained, and there's a lot of pressure being put on the teeth. So, in reality, most of us, actually everyone, should not be touching your teeth during the day unless you're swallowing. It's like a very weird little fact. But when you chew, you don't even touch your teeth together. When you bite into stuff, it's like the teeth are touching the food, but not each other, ideally. And you would know if their teeth touch. It's like that terrible skidding sensation, which ideally never happens. So if your teeth are touching and being ground into, that is not a healthy position to be in. And over time, the teeth can't hold up to that. The jaw joint, the muscles can put a ton of force. So tooth on tooth, the enamel starts to wear down, it starts to crack, it starts to even tilt or change position over time. It can cause tooth loosening. And for some people, it can also cause bone loss around the teeth, which looks like gum recession. So the gums recede when the bone recedes. And absolutely, it's something that you want to address earlier rather than later, because as the teeth wear down or the bone wear down, we lose teeth, we lose structure, and all of that is actually what's supporting the lower half of the face. So the distance between our nose and our chin over time starts to get shorter and shorter and shorter. So you start to get kind of like this flattened lower face, and it really, really changes the way people look over time. We start to look old a lot faster.